Here are some guidelines on antiplatelet therapy after coronary stenting. First, some acronyms that we're going to use here. BMS refers to bare metal stents. DES refers to drug-eluting stents. DAPT refers to dual antiplatelet therapy. That's aspirin plus a P2Y12 receptor blocker, like clopidogrel. First, the recommended duration of action. A patient that has had a bare metal stent or a drug-eluting stent should get dual antiplatelet therapy for a minimum of 6 to 12 months. There are some special cases in which patients getting a bare metal stent can get away with dual antiplatelet therapy for only 4 weeks. So in general, the drug-eluting stent requires antiplatelet therapy for longer than the bare metal stent, but they both ideally would be at least 6 to 12 months. If the patient can tolerate it, if they have a low bleeding risk, for instance, you want to continue the dual antiplatelet therapy for a total of 30 months. And these patients will need to be on aspirin indefinitely. They now have a cardiac risk factor, they've already required a stent, so they will always need baby aspirin for prophylaxis. In the perioperative scene, if the patient is getting an elective surgery, you want to defer that surgery until after the minimum dual antiplatelet therapy duration. If the surgery is more urgent, you want to continue the P2Y12 receptor blocker or hold the P2Y12 receptor blocker like clopidogrel for the shortest duration possible. You want to continue aspirin in these patients unless they have a high risk of severe surgical bleeding.